Our workshop is on upper extremity and lower extremity fractures by Brittany Davis
and Kyle Lewis. In this PowerPoint, we will discuss the types of fractures, how to assess the fracture on the field, in a clinic, in a physician's office, and also how to treat it through splinting and surgery.
Below are the types of fractures. An avulsion fracture is a sudden violent contraction or stress that causes a ligament or tendon to pull a piece of bone away from its attachment. An example of this would be the Osgood Schlotters, which occurs at the tibial tuberosity. A stress fracture is an overuse injury caused by stress placed on a bone. The key marker is constant pain in a particular spot. A common example is shin splints. A compression fracture is when two forces converge in a bone in opposite directions, which leads to a fracture.
And an oblique fracture involves a rotational force acting on the bone, leading to a fracture crossing the bone at an angle. A comminuted fracture occurs through a blunt force crushing the bone into multiple pieces. This type of fracture requires surgery to repair. And an epiphyseal fracture is a fracture at the growth plates, and this occurs in adolescents because their growth plates have not ossified yet.
Following this slide, we also found information found on other fractures in the articles we researched. One article in particular popped out to us that talked about a stress fracture through the olecranon epiphyseal plate, which is seen in throwing athletes, weightlifters, gymnasts, and wrestlers.
Being able to diagnose a fracture on the field is a key skill for any athletic trainer. Some common signs and symptoms for diagnosing a fracture on the field is deformity, such as a bone or object inside the body pressing against the skin, ecchymosis, which is severe swelling or discoloration, painful palpation,
Crepitus, which is a rough grinding feeling mainly felt in the patella, false movement, which just means a stable structure that moves when pressed on when it shouldn't, when an athlete is unable to weight bear, which causes any pain, or painful through range of motion such as flexion, extension.
One of the first things an athletic trainer should do when assessing a fracture is to decide whether the injury is life-threatening or not. This can be done by observing the blood supply and the sensation. To observe blood supply, the athletic trainer should find the dorsal pedal pulse for a lower extremity fracture. This can be done by placing the middle and pointer finger between the first and second metatarsal for 15 seconds to feel for a pulse. Another way is to use capillary refill by pinching the ends of the fingers or toes with your thumb or pointer finger until they turn white, then releasing and waiting to see how long it takes for them to turn red again.
For sensation, you'll take the back of your hands and place it along the athlete's lower extremity or upper extremity. You're feeling for warmth and seeing if the athlete can feel. Also, you can use dermatomes, which we learned in this past summer. Another way is by assessing vitals. Normally, you can tell if the athlete's in shock and the level of consciousness when approaching the field in the situation. And then by doing vitals such as heart rate and blood pressure, you can also tell by the increased heart rate or the decreased blood pressure. Some different types of tests to do in the clinic assessment to diagnose fractures is listed below. In our articles, we found that ultrasound was good for diagnosing fractures in the metacarpals, distal forearm, ankle, and foot. We researched and they said that it was easy to apply and it's less expensive than doing a radiograph. We also found that it's 100% of fractures are diagnosed through ultrasound for the radius. And then for the metacarpals, we found that ultrasound has 92% sensitivity and 87% specificity. We also found that the bump test is very reliable. Diagnosing fractures, you'll take the palm of your hand and hit the bottom of the foot 3 times and assessing for pain from the athlete. And then with the percussion test, you're going to take your pointer finger and your thumb and you're going to kind of hit the base of the fingers and toes and assessing for pain.
We also have the squeeze test, which can find fractures in your shin, and that involves taking your hands and pressing on the lateral and medial sides of your shin which compresses your tibia and fibia. And when you press down, the patient will feel pain if they have a fracture. We also have the ice and tuning fork methods. These methods I got anecdotally from my preceptor at Warren County, Jeff Crawford. And ice can be applied to the upper extremities or lower extremities. And his rationale behind it is that ice will make the muscles contract, which will pull on the fracture, causing the patient pain. Another method involving the tuning fork involves flicking it with your finger to cause them sound waves, and pressing the side with only the single pointer on the afflicted area, which will send those sound waves into the bone and will also cause the patient pain.
In this slide, we're talking about the Ottawa rules, which are a set of guidelines used to decide on whether the athlete should get an x-ray done to determine a fracture. If the athlete is having pain with palpation in 2 or more of the common spots, which are the medial and lateral malleolus on the posterior edge or tip, the navicular, or the base of the 5th metatarsal, you'll send them to get an x-ray.
A physician will use some of the gold standard tests in order to diagnose a fracture. These tests include a radiograph, which is an x-ray, and it will use the oblique, anterior-posterior, true lateral views, and it will also use tests like the CAT scan, MRI, nuclear scintigraphy, and thermography.
Treatment of fractures are used through 2 different types of groups. For the immobilization, you have splinting, which is very big. You'll use the board, wire, SAM splint, traction, air, pillow, and vacuum. In a few different articles, we found that there are simple and traction splints. Wood splints help fix the organ, and traction splints are mainly used to reduce pain, though there are disadvantages with the traction splint because damage can be caused to the neurovascular system. In the end, we found that both articles reduce pain in a 12-hour span, but traction splints reduce at a higher rate. Indicated through the articles that traction splints help reduce at a higher rate because the splint stretches the muscles consistently and gradually reduces pain through the relief of muscle spasms.
And mobilization involves giving an assistive device to an athlete to maintain mobility. Crutches are most commonly used for lower extremity injuries. And for upper extremity injuries, a sling and swath method, which will be discussed in the next slide, can be used.
On this slide, it's showing how to do a sling and swath method. With this method, you're going to use a 6-inch double roll ace bandage. And what you're going to do is you're going to try and have the arm stabilize when you're suspecting a fracture. With this method, you're going to start wrapping around the wrist, up across the opposite shoulder, and around the waist, alternating back and forth until there's little or no ace bandage left, and you're going to tuck it into an open spot on the body where the ace bandage is open, and it's going to say until the end of the game or practice, or you can get them to go get an x-ray done if there's a possible fracture.
A vacuum splint is a useful tool for stabilizing an extremity fracture. In this case, it is the leg, and it involves first pumping air into the splint so that it is flexible enough to work with. Next, you will place the athlete's injured extremity into the splint and strap them in. Next, you will take the pump and pump air out of the splint, and you will continue doing this until you see beads press up against the walls.
On this slide, you're going to determine whether or not activation of EMS needs to be done. You're going to assess this by if the athlete is unconscious, if there's a loss of pulse, or if there's severe bleeding which cannot be stopped.
You will also need to call EMS if there's a loss of sensation or if an open fracture is detected. If a fracture is severe enough, a physician will be needed to perform surgery on it in order for it to heal. 2 common types of surgery are open reduction internal fixation, which is viewed on the left picture, and closed reduction internal fixation, which is viewed on the right picture.
Another way that surgeons can repair these types of fractures is by using plates and screws. This can be done by making sure that the 2 bones are going to be fused together depending on the severity of the fracture, and most likely they'll be in your body throughout your entire lifetime.